So without further ado, I'd like to invite my colleague from Helvetas, Madan Bhatta, and then Ariane Schertenleib from Eawag to give their presentation. Madan, I think you'll need this microphone.
Good evening, everybody. Today we are delighted to present novel pathways for this drinking water safety strategy in Midwestern region, and it's a collaboration between Helvetas Swiss Intercorporation and Eawag, Switzerland. And we are going to present the main results from the Risk Catalyst project. Actually, this Risk Catalyst project is a small component of water program of Helvetas in Nepal. I think most of you heard about this integrated water resource management program. Within that program, actually, we implemented this Risk Catalyst project, which focuses more on water quality. So here is Ariane from Eawag. We will jointly present this presentation, and welcome to all of you. So this Risk Catalyst project, actually, as I mentioned earlier, is a partnership between Eawag and Helvetas, and it is funded by SDC and Risk Program for Water Security for the Poor. And the objective of this project is actually to achieve safely managed drinking water. Is Sustainable Development Goal 6.1 in remote rural communities and hill area with gravity-fed pipe water supply systems. Well, we know the rural setting of the Nepal for wash. Actually, the rural area, they are remote area and scattered settlements, and there are small gravity systems where this operation and maintenance has been done by users committee. And there is low access to electricity as well. And the initial goal of this project is characterize the water quality at the system and household level, and identify system vulnerabilities and systematically test interventions. So we have a experience from 2014 to till now, and the project phases were divided like initially we started in 2014, we did this desk review. Later we conducted baseline survey in 2014 and 15, which actually we triggered to start this water quality initiatives. Because in the past we were just focusing more on construction of water supply scheme, but through this baseline survey, we have a lot of learning from the implementation of the project in the past. And then we have another phase, 2015 and 16, where we further conducted studies, and we have some case studies from that phase. And after this 2017 till now, we are implementing this risk collaboration. We will present what is this risk project, what we are doing, and finally, we also have the comparison of the baseline data and the data after the implementation of this Risk Catalyst project. So this is a summary of the baseline survey, which revealed that 2 out of 3 taps do not meet national standard for microbial water quality. The perceived water quality among the user, it was very high, that all people say the water quality is good, and only 11% say that they think that the water quality is poor. Similarly, there is no system level treatment, and there is no monitoring mechanism, and there is also low demand for this household level water treatment, and it was rarely practiced. Actually, only 19% of the household were applying this household water treatment and safe storage. And it was realized source protection should be combined with all these water supply schemes. And this is another research. Actually, we conducted this research to know about this temporal and spatial variation of the water quality. And we conducted a study for 35 days and we measured water quality daily. And the water quality was also measured at different points like intake, reservoir tank, tap stand at different locations. And the study revealed that water quality is not consistent. It is there is a fluctuation between the sampling point, and peak equally originate from the source. If there is higher level of this equally at the source, then it also has effect on other structures. And the study finally revealed that there is a temporal and spatial variation of the water quality. Then the guiding question for risk catalysts is what is an effective and sustainable water safety strategy for remote alpine regions? Here, actually it's not a new thing, but we implemented this water safety plan with some more initiatives. Actually, there are some challenges of the water safety plan for implementation in the rural area, like it's difficult to monitor water quality regularly as per this drinking water quality standard of 2005 in Nepal. Similarly, there is no capacity to do all the things, and we all know about we haven't lab in the even in the district headquarters. We only have 5 regional labs, so it's really difficult to conduct microbial water quality test. So here we started our intervention from this water safety plan. There is a well-defined this process and guideline by WHO about water safety plan. But its operational part in rural area is a little bit challenging, we say. And we added other things. Here is water safety plan. We started from here, and where we did this monthly sanitary monitoring, adapted sanitary form we developed, and we trained local people. Then we added this field robust laboratories, where there are portable incubator. We will have demonstration of this incubator later. And we used these solar panels for electricity, and we trained local people. Actually, in the lab, for example, in the regional lab, actually there is a problem of this chemist. It's really difficult. But here we trained local people. They can monitor. They cannot certify. They cannot give the certificate, but they can measure the water quality for their water supply scheme, so that the local people also have awareness about the water quality. And we also have this low-cost scheme improvement, where we implemented source protection and conservation activities in a larger area, and we added this roughing filters at intake, and in few schemes there is also this system level treatment. And another important part, actually we lack data about water quality, and we have this centralized data management system where we use AquaFlow for the data collection. We use this mobile-based technology and tablets, and water quality result and field sanitary forms and data available online in real time. So we can see the data in Kathmandu or Switzerland immediately after this data collection. So here the important part is capacity building and behavior change campaign. All over the cycle we have this strong component where we focus on this ongoing sanitation campaign of the Nepal. So after this OTF campaign, there is a campaign for total sanitation, where we have more focus on two things. One is hand washing, another is this safe water, where we promote household water treatment and safe storage. So these are the things, and just to complement again, what is added in the water safety plan is this technology and local capacity. Similarly, the source conservation part is another, and this evidence and data management is another thing. So It's like a water safety plan plus plus plus, or we can say hybrid water safety plan. We have this here water safety plan expert, so he will also have some reflection about this. So actually in this project we implemented, in the rural area with all the component of the water safety plan. So I would like to invite Ariane to continue this presentation, and she will deliver about the research finding. What was we observed in baseline and what we observed in the end line.
Thank you very much, Madan. So I will explain a little bit more about the methodology of the REACH Catalyst project, and also, as mentioned, the results of the first year, the pilot phase. So first of all, at the beginning, we began with a scoping trip and a workshop. We wanted to assess the situation of water quality and water quality monitoring in Nepal, understand the situation, identify the gaps and the needs, and fill the gap with our project. Then we identified the sites where we would lead the intervention, and we installed 2 rural labs. And then we trained the people to perform the lab measurements in the remote laboratory, and also we trained them on the adapted water safety planning approach. In order to understand the situation before the intervention, we led a baseline survey with intense data collection, including household surveys and water quality testing at the household and scheme level. And then we began with the proper REACH implementation of the intervention. So it's here these regular monthly activities and overall system upgrades. So these activities are going to be detailed later, but they involved regular sanitary inspection of the scheme with water quality testing, all done by the local community directly on site, and system upgrades along the whole project. At the end, we led another survey to assess the impact of the approach. So what did we achieve during the year of the Catalyst project? We installed 2 rural laboratories to ensure local quality control. We established a monitoring regime for water quality sampling and system inspection. I forgot to mention it happened in the Dulu municipality. So you can see the 2 labs here and the schemes in green. So we upgraded 5 piped water schemes. We also improved the chlorination practice in an urban area, and we disseminated our knowledge. So the interventions were quite diverse. First of all, there were the system upgrades. After the sanitary inspections, we identified the risks in each system, and we implemented simple but effective measures to reduce these risks. And as Madan showed you the graph, you can see that the source is very often vulnerable, and it's the base of a lot of contamination of water in the scheme. So one of the interventions is to implement one of these simple intake filters that already prevent contamination entering the scheme. Another system upgrade is the source conservation. So here you see the plantation of plants to protect the hydrosphere. And the core of the REACH intervention was the regular sanitary inspection along with water quality monitoring by a trained staff. So, what were the results of this year? First of all, we went to 75 households to interview them about their water quality practices and perception. You can see here the intervention schemes. We implemented the intervention in 5 schemes, and we had 3 control schemes where we just led the baseline and end line and no intervention in between. The intervention schemes are the one where the REACH intervention happened. So you see in light blue the amount of households perceiving their water as safe in general. So you can see that in the intervention and control schemes it was already high at the beginning and it remained pretty high. What is interesting to see is the dark blue lines which is the amount of people using a household water treatment system. So in the intervention scheme, 70% of the people reported using treating their water at the household level, and after our intervention, this rose up to 100% of the people using a household water treatment. And in the control area, it remained the same, so no changes. So we can see a significant improvement in uptake of household water treatment with our intervention. Then we also check the water quality in terms of microbial water quality at the household level. So here you have the geometrical mean of E. coli contamination. And in the 5 intervention scheme, you see from baseline to end line a consistent decrease in contamination. And in the control schemes where we didn't apply our intervention, there was no consistent trend. It was in nearby community, but far enough. Same word? Separate word, yeah. So in the intervention community, we see a mean reduction of 17 E. coli. And then we sampled water quality in each scheme at the household level, the reservoir level, and the tap level. And in the intervention schemes, we saw a decrease in each of these sampling points, but 2 of them were statistically significantly proved. So at the household level and at the tap level, there is a significant decrease in contamination. At the RVT level, you see also a decrease, but due to the low sampling size, we couldn't find a statistical significance. So to sum up the key findings, the baseline scenario before our intervention was already pretty optimistic. The people were in general happy with their water, and we didn't see huge contaminations in the system, so it was already working pretty properly. But we still saw a big uptake of household water treatment in the intervention zones only, going from 70% to 100%. And also the water quality significantly improved in the intervention zones at the tap level, where we went from an intermediate risk to a low risk, even going having half of the tap at the WHO guidelines. And at the household level, we went from a high to intermediate risk to a low intermediate risk, with again half of the households at the WHO guidelines. So after this 1 year of REACH Catalyst project, we shifted to an 18 months extension of REACH Accelerated project. So this is happening right now. And we're going to replicate what we did in Dulu in 4 new districts. So we're going to expand this project. And what do we expect from this project? We want to extend the safe water services to 4 new districts, so 5 in total. And we want to generate recommendation for replication in other districts and other countries. So for that, we're going to upgrade 18 additional pipe schemes, again with source protection, chlorination, repairs on the scheme. We're going to install new rural laboratories and knowledge centers. We're going to establish the regular monitoring and inspection in each scheme. And we're going to share our knowledge via policy brief, conferences, and all of that will be open source. So a lot of reports are on their way to be published. So please keep in touch with us if you're interested. So I'm going to give back the microphone and we will take questions later. Thank you.
Okay, thank you very much, both Ariane and Madan.